Welcome to Grand Rounds in Urology. I'm Diane Newman. I'm a urology nurse practitioner. I'm an editor here on the website. And I'm very excited because today I have a guest with me, Dr. Corinna Hughes, who's going to discuss the fellowship program in urology. Welcome.
Thank you. So thank you for having me. Let's go ahead and get started. So some of the topics I'll be highlighting today include the role of APPs, specifically my role in outpatient urology. I will absolutely be highlighting urology APP fellowships and then reviewing some common urologic procedures that are performed by APPs. And I'm going to emphasize or more so highlight the urologic procedures performed by APPs in my own department. I have no disclosures. So a little bit about me before we get started. You can tell from my accent, I am from Kentucky, but I currently reside in Minnesota. I received my BSN and my doctorate degree from the University of Kentucky. Throughout my DNP program, I worked in the ICU. And through my DNP program, I sought out opportunities in urology and women's health, and I loved it. However, I knew that urology had a ton of subspecialties, and boy, that was a lot to take in. So I knew I wanted to dive into urology, but I wanted to know everything about urology, that I could at least, and gain some insight into the procedural realm of urology. So I utilized YouTube, LinkedIn, various Google searches, and looked up, are there urology APP fellowships? Because I knew there were primary care fellowships. And I found a few, and I applied to a few. And obviously, I pursued the Mayo Clinic Urology APP Fellowship in Rochester, Minnesota. And after that 12-month-long fellowship, they hired me on, and I am still there now, practicing in an outpatient clinic and performing outpatient procedures. I've been at Mayo now for 5 years, if you're including my fellowship time. And currently I'm at a point where I'm still learning all things urology. Learning is continuous, but I'm also sharing, educating. I have learners with me, students, and also sharing some insights into being an APP in urology and just an APP in general through social media. So that's a little bit about me. Now, the Urology APP Fellowship. The first APP fellowship was in 2007, and that was a primary care fellowship. And since that time, APP fellowships have just exploded. There are various subspecialties within APP fellowships now, including urology. There are 15 urology APP fellowships currently in the nation. And the why behind that, as far as from the urology perspective, is one, AUA released a white paper where it talks about, hey, we are having increasing urologic demand and there are physician shortages, and APPs can be utilized to meet that demand. And through urology APP fellowships, we're able to dive more into urology with hands-on experiences that can build our confidence and our procedure skills, as well as help us as APPs explore the various subspecialties in urology. Now, how we get there through a urology APP fellowship is many different ways, because all urology APP fellowships may be a little bit different. So what I'm going to highlight today is more from my own personal experience. And I'll also highlight what I know about some other urology APP fellowships. So generally, a urology APP fellowship will have didactic curriculum, meeting and journal clubs, like books provided, specific guidelines to read at specific times, have exposure into the adult and pediatric realm of urology, and also some OR exposure that can either be shadowing, but there are also fellowships that allow first assist experience, which I think is amazing. And some urology fellowships also allow for mentored cystoscopy training, which is great. And that's what you can see from the picture here on the left is actually one of our previous urology APP fellows. She's currently within our department. Now, within a urology APP fellowship, sorry, I keep repeating that so much, The program is vast. Every 2 to 3 months, you are switching your clinical rotation, and that can be through general urology. Month 3, you're in a stone clinic, and it keeps exchanging from reconstructive urology, urogynecology, pediatric urology, our men's health team. And woven within that could be cystoscopy training. Usually that's at the end of our fellowship at least. Some exposure into urodynamic interpretation and some OR shadowing experience like I mentioned beforehand. The picture on the right is from my graduation after my fellowship. They have a graduation ceremony, and those are the mentors that help lead the way. Now, after I finished my fellowship in 2021, my orientation was somewhat short because, hey, I had been in that department and had exposure to urology within various subspecialties for 12 months, right? So my orientation, again, short, and I was ready to roll after the fellowship. So what my clinic day looks like, it's either one of the four. Either I'm practicing independently, and I do practice 4 days a week with 10-hour work days. And on my own in clinic, I'm either seeing a new patient, so new consults or established patients. I can also work in a collaborative care team. So our department has a collaborative care team model, which allows us to increase our patient access as well as ensures continuity of care. And that can be an APP working directly with the surgeon. And generally, we also have a nurse a part of that team on those days. There's also the opportunity to work in our cystoscopy clinic, where either in the morning or the afternoon, that's what you'll be doing is performing cystoscopies. Generally, it's about 2 to 3 every 30 minutes. So you definitely have a lot of cystoscopies in. And then we also have our transperineal prostate biopsy clinic, which in the morning or in the afternoon, that's what you'll be performing, our prostate biopsies. So one of the four is kind of what my day looks like. And sometimes it's a mix of a few. Now let's reference my week this week. I just wanted to give you a little input regarding that. So on Monday, I start at 7 a.m. So at 7 a.m. and 7:30, I either have a new consult or an established visit. And then I was APP of the day. So I'm there to assist if someone is gone, if there's a call, if something is needed, I am there. On Tuesday, I started off with my own clinic, again, 7 a.m., 7:30. And then in the afternoon, I had the prostate biopsy clinic. Wednesday, again, independent calendar, but in the morning and the afternoon, I was in the prostate biopsy clinic. So that means a biopsy at 8, 9, 10, 11. I see a patient at noon, and then in the afternoon, prostate biopsies. And then on Friday, I will be in the cystoscopy clinic and the prostate biopsy clinic, as well as seeing my own patients. So it's a good mix. Now, there are 25 APPs within my department, and that mix of procedural opportunities is definitely there. The procedures that you see here listed are what the APPs in my department are currently doing. Not all APPs, but the APP procedural list of what we could be doing or what some are doing are there. Currently, I am performing cystoscopies. I'm learning now retrograde pallograms, how to perform those. Ureteral stent removal, absolutely, that's something I'm completing. We talked previously, prostate ultrasounds are something I'm doing, as well as transperineal prostate biopsies, and that includes systematics with or without MR fusion, so with the target. And that is where I'm at right now. A lot of what the fellowship helped me with, as far as from the procedural point of view, is the cystoscopies. I had to complete at least 200 before I was certified within our department and was able to complete those independently. And knowing that at the end of my fellowship, knowing that, hey, I'll probably be staying here at Mayo, at the end of the fellowship, I was able to branch out a little bit and learn how to perform prostate ultrasounds, as well as starting to gain those skills of how to perform a transperineal prostate biopsy. And a lot of my orientation time once I started my job was learning how to use UroNav and how to perform a targeted prostate biopsy also. So the learning has continued, and again, still learning here and open to procedural opportunities, and that's always changing within our department. Now, that was a short review of urology APP fellowships, as well as what my day looks like. And if there are any questions, I want anyone to reach out to me through Instagram, through Twitter, or LinkedIn. I love to connect and gain insight into others' day and into what others are doing. And thanks, guys.
Thank you so much. That was so informative. And, I know our audience is really interested in these fellowships. And thank you for your information as far as how they can reach you, because I have to tell everybody I found you on LinkedIn. So that was a really great way to really find out who's doing something in urology. You said you had to do 200 cystoscopies before, you were kind of quote competent or certified. Tell me what happens. Go through that process. So you do it under supervision. Is someone else also looks at, the inside of the bladder? You know what I'm saying? Explain a little bit about how that would be done.
Absolutely. So through the fellowship, you are paired with an APP as well as with a physician if they are on the cystoscopy block, because we do have a cystoscopy clinic. I also call it a block, so I don't want to be confusing anyone, but we have morning cystoscopies, which again, that can be up to 16 to 20 plus in the morning, and the same thing in the afternoon. So we are paired with an APP in the morning or in the afternoon, and we are assisting them with the cystos, and when it's deemed appropriate and we have garnered some of those skills, know what to look for, know the routine, then the scope is in our hands and they're right beside us in the room. So it's very like a one-to-one approach, which is why the fellowship is so great, because you do have that flexibility and that safe learning environment where there's no rush for you to see patients. Hey, you need to get this to kind of earn your place here. We need you, but it is that open learning environment where that is your purpose there, is to learn. And we want to make sure that you have those skills. So at the end of the fellowship, there were several days where, hey, in the morning or in the afternoon, that's all I was doing, was with an APP, looking through pictures, talking about bladder cancer guidelines, and like kind of what to do next. So it's very, very informative, structured process. And we keep track of every cystoscopy that we performed and what we had seen. And we have to show that we had completed at least 200 and have the competency from the team or the mentors that we were with before we have that check off from our department of, okay, now you can practice independently in performing cystoscopies.
Is that a similar then process too? Like if you do the transperitoneal biopsies and that, is that also very similar as far as how that training is done?
Absolutely. We have a protocol set for both. For the prostate biopsies, if you are, whether you're a fellow here or new here, generally within the fellowship, that's not something that's expected to be learned, unless someone shows interest in that, or maybe they'll be doing that at the job they have lined up at the end of the fellowship. But for someone learning prostate biopsies within our team, yeah, it's a slow approach. You're with someone one-to-one, working through all of the basics, and eventually, once you are deemed competent in that, yes, we have, and following the protocol, then yeah, you're deemed appropriate and you can practice that independently.
How many years has this fellowship been in place at Mayo?
I will be, I don't want to be wrong. I think we've had 6 or 7 fellows at this point, and I think since 2017 or 18, but do not
see. What is the length of the fellowship then? How many months is it before then you're out there kind of practicing on your own?
For the Mayo Clinic Urology APP Fellowship in Rochester and in Arizona, it is 12 months.
Really? So it's 12 months. Is it 12 months before you have your full schedule, or do you slowly, gradually go into a schedule? Like how is that? How's it incorporated?
So you don't have your own schedule. You are always with an APP or a physician working collaboratively. You can independently see see a patient. However, it's generally reviewed by our APP or our physician, each patient that you see, to make sure the kinks are worked out, and we're always talking through it.
And that's really 12 months then. Is that kind of, you always have that mentoring going on then, right? That's
Well,
really impressive.
yep, switching every 2 to 3 months into a very subspecialties. And that's why you're always with an APP, because month month 1 and 2, you can be in general urology, and then month 4 and 6, you may be in reconstructive urology. Different world, different patient population. You want that one-to-one mentor opportunity with an APP to talk through those patients. So 12 months of that, which creates a foundation. Obviously, there's still more to learn after a fellowship, but it definitely creates a comfortable foundation for you to be somewhat confident in how to interact with different the different subspecialties within urology and get a head start.
Now, your APPs, it's a mix of nurse practitioners and physician assistants. Is there any kind of ratio, or just really, it's just a mix of both kind of specialists?
Yeah, it is a good mix of both. I would be guessing if I was to tell you what is the specific ratio within our department.
And you have this fellowship in Minnesota at the Mayo, and then in Arizona. What about your Mayo down in Florida? Is there a fellowship there also, or?
I'm not aware of a urology APP fellowship there, but there are fellowships outside of Mayo that are urology APP fellowships.
Yeah, I know, like you said, they're growing, right? There's up to 15 now, and more are doing it. The other thing too, like say at the end of your training and you're kind of competent, you feel secure, are you able to specialize in a certain area, like, I don't know, maybe reconstructive or GU cancers, or is it always that it's spread over all the different type of urologic conditions?
Mhm. I think that's more so keen on the department that you're going to be working with. For us, we are very subspecialized. So after I finished my fellowship, I knew I was going to be with general urology and a heavy emphasis in urogynecology. A fellow that maybe graduated 2 years after me, she's with reconstructive urology. She still has general urology within her own independent calendar, but the surgeon that she works with and most of her patient population that she's working with is those with like neurogenic bladders or urethral strictures.
I see. So you kind of are able to kind of maybe specialize within the urology practice into something that you're really interested in. That's really kind of great.
That is an opportunity in our department, and that is something I love, because we know the go-to person within our department that, hey, that's what they do primarily.
That's really great. Now, do you do in your main campus, or do you also go out to satellite offices and also practice there also?
So through Mayo Clinic, we do have the Mayo Clinic health system that have APPs there. I am just only actually on the main campus. The opportunities to go to some of the rural areas, that is an opportunity through the fellowship, where you do have the opportunity to have exposure through our Mayo Clinic health system. So I was able to go out about an hour away from Rochester in a more rural area during my fellowship to kind of see what it's like more in a rural setting without as much of the things that we have at our fingertips on the main campus, which it's good to see.
Yeah, what goes on? You're doing some pelvic floor. Are you doing any Botox injections and for individuals with overactive bladder retention? Are you doing any of those?
In the pelvic floor?
Well, for Botox injections, as far as introducer injections of Botox, is that also part of training?
No, as an APP procedural opportunity, that's not something currently
I was
there.
wondering. Yeah, I'm hearing more and more people are starting to do that, so I was just wondering. Well, listen, this has been so helpful and informative. Really appreciate your doing this.
Thank you so much. It's good to be here. I'm glad this APP Learning Center is getting started, and it's been, I can't wait to highlight it more for APPs.
Thanks so much.
Thank you.